And good evening, everybody. Welcome to another episode of Let's Talk About It. This is sponsored by the Harford County Health Department Minority Health Program. We are so excited and happy to have all of you join us on tonight, where we talk about local health disparities and public health issues that affect everyone in Harford County, especially our Black and Brown community. So, before we get into our topic for tonight, we have some very important announcements that we are super excited about. If you saw the title of our program, we're going to be talking about the benefits of good dental hygiene, and we have some special guests waiting in queue for us to sign them on. But before we do, Michelle, do you want to start with some of the announcements, or I'm going to start?
I do have some announcements to start off with. And so Thursday, April 28th, we have the Project Connect, which will be at the Epic Center, 1918 Pulaski Highway. It starts at 9 a.m. and it ends at 3 p.m. So be there and be square and don't miss out. There's a lot of
Right,
resources.
be there or be square. Listen,
Right.
Michelle and I will be there all day. And
Yes.
if some of you are familiar with this, it used to be called
Project Homeless Connect.
Project Homeless Connect.
Yeah.
And I'm going to tell you something. You can get a birth certificate there for free. If you've ever gotten your birth certificate before out here in Harford County, it is either $25 to $30 a pop. Okay? But if you come on Thursday at the Harford Community College, you can get a birth certificate for free.
Epic Center. It used to be at the college. Is that Epic Center?
Oh, yeah. I'm so sorry. Listen up. It is at the Epic Center,
Yeah.
the one in Edgewood, the Edgewood Epic Center, and it is free. And they have a whole bunch of wonderful resources there. So meet us out there because Michelle and I have some good surprises for everybody too.
Yep.
The next announcement we were going to make is for April 30th. And we want to say hello to our Edgewood family out there. We are so excited to be able to partner with you this Saturday for Kite Day. And you have to forgive us because we had some technical difficulties prior to getting on. And so we would have a flyer for you, but it is on our Facebook page. It is on Edgewood Family's page, and it is on our webpage for Harford County, the Harford County Health Department. You can see our website right down there. Okay, they're going to be. I think that this is something that they do annually. They fly kites. Is that right, Michelle? They fly kites.
Yep. They're going to have refreshments, games.
Yes.
And it's just going to be all about friends and family at Cunyon Field.
Yes, Cunyon Field.
Saturday from 10 a.m. to 2 p.m.
Guess what, Michelle? I'm advanced. Look, y'all. Ooh, I got the address right there. There it is, Cunyon Field, across from the Kohl's warehouse. Be there. Join us. We'll have some other games out there, some field games. I know Edgewood Family, they're going to have a lot of refreshments. We'll be bringing some things as well and some resources and some great, just some other stuff. Just come on out with your family and enjoy yourself. And also that's April 30th from 10 to 2 p.m. Okay? And there goes the announcement again. Kite Day.
Mm-hmm.
Another announcement that is very dear to us. We've been working on this. We know that during the pandemic, a lot of our young people have dealt with the stressors of distant learning, the stressors of not being socially connected. And we know that during the winter seasons, when kids were back in school, they were having a lot of behavioral health challenges and mental health challenges. The uptick in fighting was up more than it's ever been. We don't have complete data on that because during the pandemic, that data was not able to be updated. But we were concerned about our young men, and we were concerned about our young women, and we were concerned about how they were able to connect with their mental health, just with depression and anxiety, their social connections, self care, and how to de stress. We took a survey over the months of some of the young people in Edgewood, Aberdeen, and Havre de Grace. We partnered with the Boys and Girls Club to collect data about what concerned them the most. And birthed out of those discussions, we have come up with a lock in, and we started with the boys first. And that's going to be May 20th at the Aberdeen Epic Center. Get excited. I'm telling you, it's going to be wonderful. We're partnering with the Boys and Girls Club on this issue, and we have brought some wonderful speakers out, parents. Your boys that are in middle and high school are going to be completely loved on. They're going to get basketball jerseys. They're going to get just backpacks and
a bunch of other things.
We couldn't even name them all. All we want you to do is, this is the name of the event. It is called I, We, You Matter. Okay? And it's sponsored by the Harford County Health Department, and it's sponsored by the Boys and Girls Club. It is going to be from 6:30 to 12 midnight. There's a flyer that's going to go out on our page. And since we're making this announcement today, there's going to be a registration link that your parents have to register for it. Or if you're an adult listening to this, you can pre-register so we can make sure that we have all the supplies ready for your young adult as soon as they come in. I got some other fancy tricks here. There we go. It is so important to us that we love on our young men out here. We want them to feel supported. We want them to feel connected. We want them to feel loved. We want them to know that they are not alone and that we care. We all care. And so this was created by a bunch of leaders out here that care about your mental health. So please pre-register. We are going to have a ball. We are having a ball planning it, aren't we, Michelle?
Yes, we are.
Oh my gosh, we are having so much fun planning this with other young students and also adults. There's not just the women. It's just not the moms sitting around the table. Okay, it's a lot of us, the men and women and young people putting this together to make this a great success. So please look out for the flyer, share it with a friend, and pre-register. So without further ado, April is Minority Health Awareness Month. And we wanted to highlight something that is not often talked about, but is extremely important in our everyday life. We wanted to talk about the importance of good dental care. And guess what? The Harford County Health Department has a dental clinic that is located in the shopping center where the wash and fold is. I'm sure when they get on, they can tell me the exact name of the shopping center where the wash and fold and the food line is. There is a dental clinic there. It's been there for many years, and we have a dental hygienist that's going to come on from the clinic, and we're going to bring her on in just a second. And we have an administrative specialist from their department on to answer some of our important questions. So listen, I know some of you have already seen the topic. If you have questions, put it in the chat. We'll read it and we'll ask it live, okay? And if you just want to join in the conversation and say something, let us know. We might be able to pop you on here with us. Okay, so without further ado, we have Shaya, and she's coming on. Hold on, there we go. Uh-oh. I think my
Here I am.
Here
There
you
you go.
go. Hello.
Hello. Good evening.
Good evening. If you could just give us your full name and title, and I'm going to bring on your associate.
Hi, my name is Shaya Rosette, and I am a registered dental hygienist with the Harford County Health Department. They're a dental clinic in Edgewood.
Awesome. 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 And this is very, I'm so sorry. And I'm going to bring on your co-host in a minute.
Is it my internet or is everyone freezing up?
While we're waiting for
I
that to
think I'm
work,
moving up.
we are going to just give us, if you can just give us a little more information about what you do and who you are. And
you guys hear me?
I don't know who's talking. I hear someone.
I think that's what it was. Everybody was freezing up.
It's Nicole.
Yeah.
Is everybody there? Oh my gosh.
Yeah, we're here.
We're
Yes,
still
I'm here.
we're still
Can you hear us?
Yep.
Oh wow. Can everyone hear me?
Yes.
Can everyone hear me?
Yes.
Mhm.
I hear you now,
Yes.
Nicole. Wonderful.
Okay.
So just introduce yourself.
Nicole Elphick, Administrative Specialist
We're gonna
Harford County Health Department.
Thank you. Thank you so much for joining us. We really appreciate you both being here. I just need everybody to bear with us as we're live and we're having some technical difficulties tonight, but it's okay. If you want, you can just kind of put your thumbs up and let us know that you can hear us, or you can hear us, or you can't, Okay. So we just need you to give us a little history about the Edgewood location dental clinic. How long has it been there?
We opened March 31st, 2008. So about
14 years. Okay. And what kind of clientele does this clinic service?
well, we service children and pregnant women on Maryland Healthy Smiles dental insurance, which is Medicaid through the state of Maryland. So
Right.
children 1 through 21 and pregnant women who are on the Medicaid program.
Okay. Okay. And if you can tell us a little bit, how many dentists are on hand at that clinic?
Currently, we have 2 dentists staffed right now. We have a general dentist, Dr. Asia Houston, and we have a pediatric dentist, Dr. Haider Alshami. Okay.
That is really good to know. And how long do you just see those on Medicaid? There's no other insurance that you take. It's just medical assistance.
That's correct. We only take medical assistance. We don't take cash, self-pay, sliding fee scale, just solely Maryland Healthy Smiles through Medicaid.
Okay. And that is still good because we do have a lot of our residents out here in Harford County that are on medical assistance. Either they're pregnant or they have children under the age of 20, and they can go and visit your clinic with that insurance, right?
Yes, that is correct, until they turn 21.
Until they turn 21. That's wonderful to know. That's good news.
Yes.
To know. And we're going to go over to Shaya, because this is really the real crux of what we're doing. She got. We're going to try to put her back on. Y'all bear with us tonight, please.
It's the allergies. The system has allergies tonight.
The system has allergies tonight. Really? Let's see. There she is. Shaya, can you hear us? Okay, we can't hear you.
Can you guys see me?
Oh, good. We hear
Now
you
we
now.
hear
Oh,
you.
we can see you. Wonderful.
Okay.
So,
I was like,
Shaya,
oh no.
this is the crux of this.
You're breaking up.
I
Yeah,
know
it's breaking up.
this is really unusual. This is so unusual. But we're going to get through this. We're going to get through this because it's so important.
Mhm.
Okay. We're
I can hear now.
going to get through this. This is so important. Okay, let me see. I was having connectivity problems. Can you guys hear me now?
Yeah, I can hear you now.
It's
My
just a
end is
delay
breaking
with your mouth
up.
and the words.
Oh my God. Can you hear me now?
I can
Okay.
a little bit.
Okay.
Yeah, I can hear
breaking
you
up.
now. I can hear you.
Could you, Shaya, in the interest of me breaking up, it's so important that pregnant women by the dentist.
It is more of prevention
Could you
is
tell
key and early
us how,
detection is key. Oh, can you hear me, guys?
could you
Yeah.
tell us
Okay.
how important it is for pregnant women to see the dentist?
Okay. Yeah, so it basically is early detection is key. So it's important once a woman
Okay.
finds out that she's pregnant,
So Shaya, are you
it's a delay.
able to share that with us? How important
She is sharing
it
it. I think there is a
is
delay on your end.
for
Yeah, it's a lag or something.
pregnant women, or Nicole, to tell us how important it is for
Sure.
pregnant women to see the dentist?
Can you guys hear me?
Yeah, I can hear you.
Okay. Well, like Shaya was saying, early detection and prevention. It's best for them to be seen like
It's
this
more for
as soon
prevention.
as they find out they're pregnant. Mm-hmm.
We can hear you.
Okay.
Yeah. Can she hear?
Go ahead, Shaya.
Huh?
I said,
guys
go ahead,
hear me?
Shaya.
Yeah,
Yeah,
I can
it's
hear
really
you.
important.
Okay, I am so glad, folks.
No, it's okay.
I am sorry.
Yeah, so basically,
So yes, and
um,
yes, I did hear someone.
that
I
early
think.
detection is key.
Mhm.
Because it's important to minimize the risk of
Michelle,
the
did you want to ask
infectious
questions as
bacteria.
well? Because I was hearing that. Can you all hear me?
Mm-hmm.
Yes.
Can you
Yeah, now I
all
can.
hear me?
Mm-mm.
Yes.
Can you hear me?
Yeah, it's like breaking up a little bit.
Yeah, it might be her computer.
You all hear me?
Not really. It's like breaking up.
Yes, I was. Can you all hear me now?
Yeah.
Okay. Yeah, I can hear it now.
Mm-hmm. And so,
I mean,
yes, that's what
the
we were
thing is,
hearing about minimizing from either cavities or tooth decay, how that affects the base health as well.
Mm-hmm.
Oh, wow. I am so sorry.
yeah.
Can you all hear me now?
It's okay. Now we can hear you.
Okay. Hold on. Can you hear me now?
Yes.
Okay.
Yes.
I am so sorry about the connectivity. Oh, can you hear me now? Can you all hear me now?
Yes.
I'll fix that at the moment. Listening audience out there, us just 1 second while we.
It's okay. This is the world that we're living in now. We're using more technology, and there are definitely issues when you're using technology.
Yeah. You gotta love it.
Yep.
I said, just imagine the kids during COVID having all these connection issues. So it's okay.
Right. Yeah. I say, everyone, grab a snack while we get this fixed. To the audience.
Okay. I'm gonna try to move it.
Can you guys hear me now?
Yes.
Can you guys hear me now?
Yes.
Yes.
Woo, it's fixed. Oh my goodness.
Yes.
That was torture. I am so sorry. Woo. I think it was just the computer that I was on. I had to switch off and then get onto my other regular computer. So thank you. And all because everybody's face was looking so weird. I was like, why are they looking at me like that? What's going on?
Well, the funny part was they were answering your question, and you were like, "Can you answer it, Nicole?" Then can you? It was like she was answering it, but you couldn't hear her.
And then I'm looking at strange faces. I said, what's going on? I'm moving. Are you moving?
That's funny.
Well,
So
now it
here
looks
we
like
go.
Shaya is frozen in a wonderful pose. She's having a
Yeah.
We're
good
having
laugh.
some fun
gorgeous.
tonight. This is musical chairs.
Yeah.
Musical chairs. So if you all can hear me, I was saying that it was so important that, we were talking about the fact that keeping our teeth clean helps our body function better, and
Absolutely.
sometimes we don't always take that into consideration. And we want to get across to all of our listening audience how important it is to brush your teeth. So let's start with the basics. How often should we be brushing our teeth?
At the minimum, twice a day.
Yep.
In the morning and most before bed.
Most importantly for our bed. And
Yes.
I wasn't always a big flosser, but when I got my braces on, I realized how important it is to floss because you can get cavities in between your teeth when you don't floss.
Absolutely.
And also, we can't hear you. Shaya, we're looking for you. Were you saying something, Shaya?
We
Uh-oh.
can't hear you. They say technical chairs.
I know,
difficulty
difficulty chairs. and that's okay.
Yeah.
So we also want to make sure that people know that when you're living out in Harford County and you have medical assistance as insurance, um, or and you're under the age of 20, you can go to the Edgewood Clinic. Other than that, if you are an adult and you need dental care and you have medical assistance, unfortunately, there aren't a lot of options, but there are numbers that we can give you to get good dental care that might not necessarily be in Harford County, but you can reach out to us. We have our web page down here for you to connect with us, so we can connect you with a good dentist. Okay. Um, we also wanted to ask, even with the clinic that where you are right now, what type of the clientele that you have in, but what kind of cases do you see? Do you see a lot of missing teeth in children, or do you see a lot of decayed teeth in children? You know, um, how do you usually work that? What do you mostly see when you come in? Are your repeat clients keeping their teeth clean, or they're
I would say the caries rate seems to be a bit high, like the decay rate seems to be a bit high. We do tend to see a lot of young children with cavities, and mostly I believe it is diet related, and just as much, care. But I think the diet now too has become so sugary, and it's detrimental to the children's
Mhm.
teeth.
Yeah,
Actually,
yeah,
what they're drinking.
yeah. We feel as though that is an elementary issue, but it's a paramount issue to understand that our diet plays a lot in how clean our teeth are, the cavities, sugary drinks.
Yeah.
Do you give out information for the parents that are pregnant about the sugary drinks, and try to avoid so much
Um,
sugar in your children's diet?
yes, we do. Well, the patients receive education at the visit by dentist, and absolutely again with the dentist if they're returning for fillings or restorative care. Um, we talk about it a lot, especially like pediatrics. Try to let them know about drinking juice, because some pediatricians say it's okay, but juice or sugary drinks like sweet tea or some children even drink soda. It's just it's detrimental to their teeth. Like you said, some people get cavities between their teeth, and that's a lot from sugary drinks, like being in their mouth constantly.
Yeah, yeah. Do you see a lot of cases where, like, I know that as I was coming up, children with pacifiers a lot in their mouths?
We
Um,
do see some children with habits, whether it be a thumb or pacifier.
mhm.
Hmm.
So yeah, and it's so important. Do you refer them out at any age if they need an orthodontist?
Yes, we do. There are
Hmm.
a few orthodontists in Harford County that take Medicaid, and they do also offer payment plans too, because Medicaid doesn't necessarily cover everyone. Maryland Healthy Smiles, I should say, doesn't necessarily cover everyone for orthodontics. They do have a
Hmm.
system,
Hmm.
and if you don't get enough points, they don't pay for um, the entirety of the braces. So the orthodontist will usually work with a parent to get the child through
Hmm.
braces, with it be a payment plan or something of that nature.
Hmm. Well, and that is really good to know. This is some basic information that if you are pregnant and you have a child that is under the age of 20, or if you really need to make sure that your teeth are clean and keep your appointments. It is a part of your overall health. And Shaya, are you on? Can we hear you? This has been a lot of fun tonight. I'm gonna tell you something right now.
I don't know if you guys can hear me. I'm staticky.
It's staticking.
It's staticky.
Yeah.
Yes, very staticky.
It's okay. It is okay. And all, but I think the most important thing I want us to walk away from, whether you have medical assistance or any other type of insurance, um, whatever insurance that you have, go get your teeth cleaned. It is a part of your
Yes.
overall health. It is so
Yes.
important as good hygiene. Your overall stress levels will go down, and the fact that if you have a job where you are paying for your insurance, you're paying for this once a month. So, how often should we be seeing the dentist? Should we see you once a month, twice a year, once a year? How often should we be seeing the dentist?
Every 6 months is usually what is recommended. I know that's what Medicaid to pay for the children is every 6 months.
Every 6 months. So yeah, um, I know that, even just keeping it on the schedule, an easy way to do that is as soon as you leave the office, make sure you have an appointment for the next
Yes.
time so your teeth
Hmm.
can stay clean and in your mouth. So when you get
Yeah.
older, you can have your own teeth in your mouth.
Yeah.
That's right. You only get one set of adult teeth.
You only get one set of adult teeth. So listen, are you all going to be at Project Connect?
I we didn't get an invite this year, and I'm thinking it must be due to COVID
Hmm.
Yeah.
and the related practices that are still going on with dental and medical settings. So I believe we can do that until this calms down a little bit more with the
Hmm.
COVID and things like that.
Yeah. Yeah. But in the meantime, listen, for those of you that didn't know, you know now that Edgewood, the Harford County Health Department, has a clinic for those that have medical assistance and they'll see your children up until the age of 20 years old. Um, we want to thank each and every one of you for your patience tonight, first and foremost. And secondly, for our special guests that have joined us, Miss Shea, our dental hygienist, and
Yes.
our administrative specialist, Nikki. We need to have you guys back on again under better circumstances with when the internet. We're going to have you guys back on again, Shea.
Okay.
But don't worry, we're going to have you back on, and we're going to ask some more of our questions and have more updates. But I'm going to have to hop you off for Shea because poor Shea with the sound of the background. She has me
Yes.
thinking. But listen, thank you so much for coming out. Thank you for even allowing us to draw attention to your clinic. I'm going to put up here again where you are located. This is the address right here. It's the Harford County Health Dental, 2204 Hanson Road.
Yes.
And if you're not sure where that is, again, it is in where the food line is, right next door to the wash and fold.
In
Okay,
Edgewood.
in Edgewood, you know where the Edgewood Creamery is. It's right in that shopping center right there. Okay. Um, so, again, thank you so much for bringing attention to this tonight about dental health care. Nikki, we are so glad that you were able to join us. And Shea, in her absence, thank you so much for
Yes.
all of this information. And for those that need more information, you know how to reach us. Look us up on our webpage. Be mindful of the announcements, these are so important. People out here, you're asking and say, well, what's going on out here? There's nothing to do. Listen to our broadcast, okay? And go on our webpage and find out what we're doing and where we're going and how we can better service you. So you all have a good evening. And until next time, this is Let's Talk About It. Bye-bye.
Bye.